Deirdre Heenan. I'm Professor of Social Policy at Ulster University, and I'm here today to talk a little bit about research that I've undertaken as part of the ARENS project, which is analysing and researching Ireland North and South. So my particular area of interest is cross-border health, an issue that has risen to the top of the policy agenda in the face of a global health emergency. The paper sets out the context of cross-border working in this area across the island, and it notes that whilst both jurisdictions have markedly different systems for the delivery of healthcare, not least different financial models, that they share similar concerns. Those concerns around a growing, ageing population and the implications of that for a healthcare system, implications of public health issues around obesity and diabetes, mental health issues around suicide, increasing levels of self-harm and anxiety, increasing levels of mental illness in the population, and also concerns about how they can design and deliver a sustainable healthcare system fit for the 21st century. So after setting out the context, it goes on to say that cross-border health is not a new area of policy on this island, and that in the last 2 decades there have been numerous examples of cross-border working, most notably under the North-South Ministerial Council, also in cooperation and working together, which is largely based around the border regions on the island, and also the large flagship programmes developed by both governments, the Cancer Service in Altnagelvin and the Children's Paediatric Services. Following this context, it goes on to look at COVID-19 as a case study as to how this cooperation and collaboration actually works and what were the implications for an all-island approach. It notes that whilst there was much talk of the disease recognising no borders, and that we were one island and should be viewed as a single epidemiological unit, the reality is that actually levels of cooperation and collaboration were quite limited. At an early stage, a memorandum of understanding was signed between both governments, but actually that produced relatively little. So we didn't have much in the way of data modelling, or joint initiatives, or joint press conferences, or a single approach to, for example, borders and border control. And it actually shows that on this island, politics will always trump, or appears to always trump, health concerns. So that even in the face of an existential crisis, politicians reverted back to type and reverted back to thinking first and foremost about the constitutional implications of what they were doing or what they might do. It is argued that there are examples of positive working across this island, and there have been many calls for the development of further initiatives, but the reality is there is no strategy for cross-border working in the area of health. Both jurisdictions and both governments have been preoccupied with their own issues, and their own issues around waiting lists, access to services, issues around care homes, social care, and ideas about developing a long-term cross-border strategy had really gone to the bottom of the in-treads. It is argued, though, that now seems to be particularly timely to address some of these issues by undertaking research and allowing us to have the information to assess the extent to which cross-border working can address some of the issues that we are currently facing, that we can assess the extent to which cross-border working would actually bring cost benefits, that we would understand the knock-on implications. So it is argued that there should be further in-depth research, and perhaps the best vehicle for this could be the new Shared Island Initiative in the Taoiseach's office. It has had funding allocated to it, and it could, for example, set in train a series of research projects which allow us to talk more meaningfully and in a more long-term fashion about what is possible, what are the barriers, and what we can hope for in the future.